I'm pleased to be joined here today on Health Beat by Corinna Hansen, a nurse practitioner with Faith Regional Physician Services, Norfolk Family Medicine, and we're discussing a preventative therapy for patients at risk for heart attack, stroke, or colon cancer. So, Corinna, discuss aspirin therapy and the advantages of following it.
Well, Rob, aspirin therapy can prevent a few certain disease problems in certain people. For example, people that might have had a heart attack or stroke, it can prevent them from having another heart attack or stroke, or even prevent death. Studies suggest that aspirin can prevent a heart attack in people who have never had a heart attack or blood vessel disease, because aspirin prevents blood clots. Heart attacks and some strokes are caused by blood clots inside the arteries. Aspirin prevents these clots from forming. It can also protect against cancer. However, we don't understand the reasoning behind that. But it can help prevent colon and rectal cancer. Aspirin does have a downside because it can cause serious internal bleeding in the stomach or in the intestine, but it can happen in other parts of the body, such as the brain. The risk of bleeding is not the same for everyone. Some have a higher risk than others. You're more likely to bleed on aspirin if you've had stomach ulcers in the past, are over the age of 65, take high doses of NSAIDs such as ibuprofen, or use corticosteroids or anticoagulants such as Coumadin, Xarelto, or Eliquis. Patients often question, though, what dose of aspirin should I take? Experts recommend that the best dose is what we call low-dose aspirin, or 81 milligrams a day. Patients choose to take this will need to take it, though, for many years to prevent these disease processes from occurring. Aspirin, though, does start preventing those blood clots the day that you take it. This means that it can protect against heart attacks right away, but the protection does wear off as soon as you stop taking it. You do have to take aspirin, though, for several years for it to prevent cancer from occurring. Whether or not you should take aspirin, though, Rob, is a decision that you should take with your provider. First off, you need to ask, would I benefit from aspirin? Second off, you need to ask if you're at risk for further bleeding. And then you and your provider will work together to make a decision. Experts do not think that healthy people under the age of 50 need to take this to prevent heart disease or cancer. They do think, though, that it will help the patients over the age of 50.
Well, thank you very much.
Thank you.
To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.